All right. Welcome back, everybody, to another Therapy Ed Office Hour. Tonight we have Dr. Jay Lucker here to speak to us about ethics and ethical practice in our field. Dr. J. R. Lucker is a professor emeritus at Howard University's Department of Communication Sciences and Disorders in Washington, D.C. He is still teaching as an invited professor, teaching the course he developed in speech and hearing science, which includes sections on acoustics. He's also written a textbook for that course. Dr. Lucker has presented numerous times on the subject matter, and he looks forward to a great presentation with you all. With that, I'd just like to say thank you so much for coming out, Dr. Lucker, and I will turn things over to you.
Thank you. Okay. Some reason something's crazy going on. I can't seem to. Okay, let me just see if this will work better. Okay, still crazy. Okay. I don't know what's going on here, but I can't bring up my PowerPoint and show it. Okay. Let me get rid of the PowerPoint and let me see if this will work better. No. Let me stop sharing. Okay. You have me though on where I can share my screen. I can also show it though.
Yes.
For some reason, I don't know what's going on. Here we go. Let's try one more time. Here's what I want to show. Here's what I want to share. But if you're familiar with PowerPoint, even you, Marta, I am supposed to get, I don't know what's going on here. If you see this, I hope you see, I can't show my screen, okay? Hold on one second.
I
Okay.
can see what you are.
Yeah, but the thing is that you don't see my PowerPoint slides, right?
No.
Right. That's why. Let me just see. I hate to do this. No, that's not it. Okay, let me just see if I can get rid of this, if this is what's doing it. Okay, here we are. Let me just see if it works now. I apologize. I'm sorry that you're, oh no. Okay, let me bring this up again. Sorry. Be right with you. There we are. Share my screen. Now you can see it, right?
Yes, we can.
Now I can
Good.
see it.
Right. And now I don't know what happened before. I apologize. But if we go till 8:05, I hope that'll be okay with you because we're starting a little bit late. So in any case, welcome to this Praxis review from Therapy Ed. And we're going to be talking about the general topic is called professional issues and ethical issues. Okay. And basically, as an introduction, when you take the Praxis review, the Praxis exam, okay, what will happen is there will be questions on it because ASHA wants to make sure that we all understand and know our profession, what is appropriate, what is not appropriate, which basically would be what's ethical and not ethical, what we can and what we can't do. And so basically what this review is, it's a review of what are the professional issues in the field of speech language pathology, what are the ethical issues in the field of speech language pathology. Okay, you already got a little bit of background information, and I am a professor emeritus from Howard University and retired there in 2022. And since then, I have still teach courses at some other universities. And one of the courses that I teach is professional issues and ethics. So this is something that I've been teaching for many years. Okay, so let us begin with an overview. ASHA's ethical practice, or ASHA's rules for SLPs in ethical practice, basically require that you work ethically as a speech language pathologist, that you follow what ASHA has developed, which is called the code of ethics. And as it says here, I'm sure you are familiar with, after passing the Praxis exam, you will apply to ASHA, get your certification, and then depending on where you will be working, and we start with that clinical fellow job or the clinical fellow years, we sometimes call it, that once you complete that, you will be getting your state license. Okay. The thing is that almost every state licensing board also has a code of ethics, and almost all of them are identical to ASHA's. So learning the code of ethics here is very helpful because it'll also protect you in terms of making sure you're doing all of the right things ethically and professionally as a speech language pathologist. One thing that's good is we're going to go over the key points of the ethics and the key points of the rules that ASHA has set, but this is the website which will take you directly to ASHA's website for ethics if you'd like to read it more as a good review. So these are key things to remember. One question that may come up is, do you follow ASHA's code of ethics? And you might say yes. You might say, what's the date? Because ASHA will update things. So you can make a note that ASHA's code of ethics as of today, as of now, okay, was a revised ethical code of ethics from March of 2023. So that ASHA's present code of ethics is about a year and a month old. Okay, so there's your effective date. Who must follow it? Okay, well, obviously, I think we would assume a speech language pathologist. By calling ourselves truly speech language pathologists, we typically mean people who are what? Licensed in the state they work and certified by ASHA. But ASHA's code of ethics also applies to speech language pathology assistants, SLPAs, if you're familiar with them, okay? Or even to students working. If you're doing your clinical practicum work, you really had to still follow ASHA's code of ethics. If you're doing your clinical fellow year, you're not yet a certified speech language pathologist because you have to finish that clinical fellowship year to get that final C's, the CCC, Certificate of Clinical Competence in Speech Language Pathology, but you have to follow ASHA's code of ethics. Okay? So the thing is that anyone who is working in the field of speech language pathology and audiology, but we're reviewing this for speech language pathologists, has to follow the ASHA's code of ethics. One of the factors that they talk about is very important. Make sure that when you work, you are not under a conflict of interest. I'll give you 3 examples of conflict of interest. Number 1, I want your services. I'll pay you for them. And let's make believe you, after evaluating me, feel I really don't need speech language services. But if he's going to pay me for it, okay, I'll provide you with speech language services. That's a conflict of interest, because now that you have that client who doesn't really need your service, but you're providing it because you're getting the money, there might be another client who does need it, but you don't have space or room to give the service to client number 2 because of client number 1 taking up your time. Okay, so that's an example. Example number 2, conflict of interest. Okay, this is a real present case. You ready? Okay, I know of a professional who was asked to do a private evaluation for a school district. The person did the private evaluation for the school district. Excuse me 1 second. And in their private evaluation, they wrote things about reviewing the school district's speech and language evaluation and criticizing it. Which, by the way, in reviewing what the criticisms are, not the criticisms of what they reviewed, you might agree, and I hope you would agree with what they say. And the thing is that the school district didn't like it because basically what they said that their school district speech language evaluation was incomplete, and the identified problem was inappropriate. And the person writing the report even pointed out complaints by the teachers, remember, which validated what some of the testing showed. Okay, but the testing was all low, but not below normal. Give you an example. Test results that were standard scores of 80, scaled scores of 6, right below the cutoff, right below the cutoff. But the school districts sometimes want standard scores to be 1.5 standard deviations. They want it to be much lower than 80. They want it to be in the middle 70s or lower before they say it's a problem. Yet the teachers were complaining about this child's language. Okay, the parents definitely were too. And the thing is, there was written, emails from the teachers and written notes from IEP team meetings or school meetings that said it. Conflict of interest. Speech language pathologist was told by the school district, change your report. Before you send it to the parents, remove that statement. Remove everything from your report that says, the criticisms of the school speech language pathologist. Now, if the speech language pathologist did that, which the speech language pathologist refused to do, it would be a conflict of interest. And in consulting with, speaking with the speech language pathologist, okay, what the speech language pathologist said was, I wonder if I should just take it out. It's not that important. My results say X, Y, and Z, and this is it. And then the thing was, they'd have to change their results to say that the child just has a weakness or borderline findings. Although their results really said the child has a disorder, and the school district the teacher is complaining of it as well as the parent. But the school didn't want to give the kid service. So there's the interest. Now, when asking the speech language pathologist, why would you want to change it? This is what you found. This is what you said. And the speech language pathologist says, yeah, but if I change it, the school district likely won't refer any more children to me for evaluations. There's a conflict of interest. They're concerned. Okay. And we're going to see that one of the code of ethics, one of the ethical codes, says they're supposed to first consider their client above anything else. Unfortunately, no one, submitted a complaint to ASHA, so the person didn't lose their certification or qualifications. Okay, so I'm going to move on. Okay, so conflict, informed consent, whether we do evaluations, whether we do therapy, whether we do research, you need to get informed consent. Now, with children, the informed consent has to be done by the parent or their legal guardian. With the elderly, if they are identified as not being able to provide, they may have one of their children, let's say it's an elderly mother, and she lives with her daughter, okay, and the mother has aphasia plus some other aging factors, dementia maybe, okay, and the daughter is really the responsible person. They have to give consent to the evaluation, consent to the therapy, okay? And then we cannot misrepresent ourselves, okay? And so that's important. We are speech language pathologists. We're not psychologists. We may see things, and even if you read ASHA, they do say that there are certain things we can do in terms of counseling, but we're not professional psychologists. We can't do psychotherapy counseling. We can misrepresent who we are, and what we're able to do. So the beginning of ASHA's Code of Ethics is called a preamble. And in the preamble, it says, ASHA requires we have the highest standards of integrity and ethical principles. Then they outline the 4 codes of ethics, okay? Hold paramount the welfare of persons we serve. This is for clients, when we do evaluations, when we do therapy, when we consult, research, everything. Our clients come first. That's what I was talking about before. The speech language pathologist saw this child from the school. That's the person who's first. That speech language pathologist, based on, it was, I'll say her, okay, based on her evaluation, identified there was a problem, that the child needed services. That comes first. I don't care what anyone else says. Okay, achieve and maintain the highest levels of professional competence and performance. Don't work in an area where you don't feel comfortable or that you feel you don't have appropriate, sufficient education. The other thing is, if you hadn't been taught this, you have to take continuing education, even once you're certified and once you're licensed. Both the state licensing boards and ASHA are going to require that. And there's a certain amount of hours they will tell you you need to have. With ASHA, it's a certain amount of points. Okay. Key points. Be sure you are appropriately educated and experienced in all areas. So in other words, let's make believe, I'll use myself as the best example. I took, like you all, probably a course where we covered dysphagia and swallowing, but I have not ever taken any courses since then. And you can see from me, I graduated last year. How's that? Is that a good idea? No, I graduated a long time ago. I have taken no courses. I've seen no patients with swallow disorders. If someone were to refer someone to me with a swallow disorder, the first thing I would do is say, I'd be happy to talk with the person and give them a referral to someone who specializes in swallow disorders, or another area, AAC. I don't work in AAC. So I would refer them on to someone who does, because it's not my education specialty, okay? Okay, be sure you're appropriately educated if you supervise. And one of the things that may be asked is, can you supervise just because you've worked in the field? The answer is no. You have to demonstrate that you have taken some coursework or continuing education in supervision before you can supervise. So it's not just out of the blue you can supervise, okay? And then the same is if you are to supervise SLPAs, speech language pathology assistants, or students in practicum, okay? Use and maintain equipment appropriately. Choose the right evaluation tools. Choose the right therapy tools and use them appropriately. Okay, be sure you're educated to use these. Okay, and just since I was talking about swallow, for example, fees. Let's say you have fees equipment. Make sure it's working properly. Make sure it's been checked. Okay, when it's supposed to be checked, make sure that what you're getting is not a false reading because there's something wrong with the equipment, but it's because the person truly has a dysphagia, swallow disorder, and get the informed consent. Okay, promote our professions. Promote our professions. We meet people. Okay, give you an example of me. I have a private practice, and I work very closely with psychologists and with other speech language pathologists. I do evaluations. I don't do, and it's in a special area called auditory processing. I don't do therapy, but I do refer and recommend the therapy. And I do a lot of work with speech language pathologists who work in certain areas where within the area where I work, who work on certain aspects of auditory processing and language, where I refer to them. Or if I work mostly with children and adolescents. If I see a child or adolescent, okay, who seems to have some kind of let's say, an attention disorder. I'm not diagnosing ADHD. It's going to be written in my report that I noticed this, but I'm not making the diagnosis, and I would refer them for a clinical psychological evaluation because I educate the psychologist and I keep my work with them very close. And I get a lot of referrals from the psychologist because of that. Okay. When we do counseling with clients, okay, I do a lot of educational counseling and answer some questions, but I don't do psychotherapy. I refer them on. Okay. Let ASHA and your licensing board know if there are other professionals that you know of who aren't working ethically. Okay. This actually was a real case with me where I had a parent come from a speech language pathologist who was in private practice, okay, who was making diagnoses of certain things like hearing loss, auditory processing, which fall outside the scope of practice of the speech language pathologist. Speech language pathologists, you all, can do the therapy once the client is diagnosed by an audiologist and given that diagnosis and evaluated appropriately. Okay. The thing is that this speech language pathologist did her, it was a she also, did her own auditory processing, what I would call a screening. And actually, it really was. It was only like 3 measures of auditory processing, identified and wrote in the report, told the parent, and then even wrote in for the parent to get insurance coverage that the child was diagnosed with a central auditory disorder and a disorder of auditory perception, which are the 2 codes that audiologists use to diagnose auditory processing disorders. And the thing is that the parent paid a lot of money for the evaluation and even a lot more for 6 months of therapy, seeing not only no change, but seeing that the speech language pathologist working more on expressive language than even receptive language. Auditory processing is input. So I educated the parent, saying that if you really feel strong about this, you have the right to contact our professional association, ASHA, and the state licensing board about this person and bring them up for unethical practices, which happened. Actually, the parent did follow through. And the thing is that the speech language pathologist, I don't know if she's still working, but ASHA, at least I know, posts, okay, that so-and-so has come up with unethical practices and lost their license, lost their certification. The state might have lost whatever. Okay. So work fairly and honestly with a high level of care for all of your clients. This is part of culture. Be non-discriminating in all areas. Okay. Know things like the difference between a speech difference, a language difference, versus a speech disorder and a language disorder. Okay. Okay. Provide equal services. Do not discriminate. If necessary, and if it comes to self-report misdemeanors or felonies or violations of ethical practices that are brought out by others, as I said, with this one speech language pathologist as the example. So let's take a quick look at ASHA's Code of Ethics. Okay, principle of ethics number 1. Okay, individuals shall honor their responsibility to hold paramount the welfare of persons they serve professionally or who are participants in research scholarly activities. And if you're doing animal research, treat the animals humanely. Okay, the thing is, that's what I've been saying. The main thing that ASHA wants is your client comes first. Know the rules. If you want, you can go here. This will bring you to ASHA's Code of Ethics. You'll see more about what they mean by this. Principle number 2, individuals shall honor their responsibility to achieve and maintain the highest level of professional competence and performance. As I said before, are you educated in that area? Should you really be doing that evaluation? Should you really be doing that therapy? And are you doing the right ones for the disorder that's been identified? Know the rules. Okay. Key point, principle of ethics number 3. Individuals shall honor their responsibility to the public. It's like what I said, talk to the psychologists, talk to the parents. I go to meetings. I do a lot of talk at not PTA, meaning parent teachers, so mostly it's PA, parent associations meetings. I'm invited to come to speak about the profession of speech-language pathology and audiology, but primarily my area, which is auditory processing. And my reason for that is it's not an area that most, even audiologists, really understand. And definitely speech-language pathologists, they don't understand it, but they can if they're given the right information. Okay. Okay. Individuals shall uphold the dignity and autonomy of our profession. Principle number 4. Okay. I have had a number of psychologists who have diagnosed or who have argued with my diagnosis of an auditory processing disorder because they did 3 subtests of one test, 3 of one test. Okay. Looking at auditory phonological sound processing. Okay. Discrimination, integration, and they call it segmentation. And the thing is that they'll say, well, my test was normal. And here's the way I introduced it. And the school district got very upset. Okay. I said, number 1, what course in speech in your psychology master's degree, it was a school psychologist, did you take that went over auditory processing disorders? And of course, there was none, right? Okay. Second, okay, tell me all of the different areas of auditory processing, not just the area you tested. And they couldn't answer that. But then I asked them, tell me what the area you tested is called in the field of auditory processing. They didn't even know the word auditory phonological or auditory phonics. Okay, because phonological, very often some people confuse it with speech production, but we in auditory processing, it's processing phonemes, sounds in words, and they couldn't do it. And then the school district did not like that because I was very well able to answer any questions that came up. What if you violate ethical principles? This is important, and it does come up as questions on the Praxis exam. Okay, what are the consequences? Number 1, if you are brought forth and someone writes to ASHA, it will go to the ASHA Ethics Committee or Board. The Ethics Board will review, and if they find evidence that supports you were acting unethically, number 1, they may say that you have lost your certification, which means you're no longer a certified speech-language pathologist, for 6 months, for 1 year, or permanently. Now, what they often do if you lost it for 6 months or a year, you have to then take coursework in some area. So they may say unethical practices. And let's make believe they expect people might take 1 3-hour course. Okay, because you were found, in violation of ethics, you have to take 2, a total of 9 hours. So it could be 3 3-hour courses, 1 6-hour, 1 3-hour, or 1 9-hour course. They may ask you, did you have to show that you have taken continuing education in this area? They also will notify your state licensing board. There is a big connection between ASHA and all of the state licensing boards. Okay. And when I say states, I include, because I come from the Washington, D.C. metro area. Washington, D.C. is not a state. Okay. It's a district. Okay. Okay. There's also licensing boards in a number of other places, Puerto Rico, licensing boards in Guam. So they're not states, but they're still part of the United States. And ASHA keeps connections with them. Okay. And many other countries, the 2 that I'm very familiar with are Brazil and Canada, will very, very often accept an American who is licensed by ASHA to come to work in their country. And if they require state licensing, they let you work for a certain period of time while you're applying to get your state licensing. Or, well, in Canada, they don't use states. They use, I guess, regional or provincial or province, whatever it is. Okay. Okay. ASHA will also make public. Okay. I think it's not monthly, but whenever it is, ASHA sends out, it used to be a magazine, but now they're doing it by email. They send out like ASHA bulletins. And one of the things in the ASHA bulletins can be, okay, ASHA's Board of Ethics has reviewed blah, 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 person A, person B, person C, and found person A, to be unethical in their practices, and their certification has been suspended for 2 months. Person B for 6 months. Person C lost their certification. So they're no longer a speech language pathologist. Okay. State licensing boards will also make public. Okay. Violations of the Code of Ethics. All speech language pathologists, SLPAs, and students, okay, without certification, okay, are responsible, are under the supervision of a licensed and certified speech language pathologist where they work. Even when you go for your CF, your clinical fellowship year, you will be working under a supervisor who is licensed and certified, because you're not yet. Okay. If the person is reported being unethical, okay, the person you supervise may be unethical, then wherever you work, they have to find another supervisor for you. Okay. And when you get the report, you'll get a report from ASHA. This has come to our attention, and here is the complaint. What is your response? They will give you time to respond, but it's not going to be a year. Okay. So it depends on the complaint. The ethics board will review and notify the person if they're found. We reviewed everything and we did not find that you were unethical. Sorry for this. Boom. We reviewed everything. You are unethical, but you need some education. We're going to suspend your license for 3 months, take a course, a 3-hour course in ethics, submit it to ASHA. They give you who and how to submit it. Okay. Violations continue. The board finds that you're not a valid, that it's not, well, I just said not a valid complaint, or it's a valid complaint. Okay. You can lose your membership even in ASHA, not only because you're no longer a speech language pathologist, you lost the certification, and you don't need to review. They will say something like, okay, you will not be renewed as a member of ASHA. This usually is going to be more like if you've had problems constantly, let's say 4 or 5 times, they're going to say, forget it, we don't want you as a member. The state licensing boards can agree with ASHA's decision, or they can say, hey, ASHA found no problems, but we find a problem, you lose your license. Or ASHA said you lost certification, we don't see that, you can keep your license. But most states require that you, as a speech language pathologist, be certified and licensed. Okay, state licensing, check this out. This goes into the state licensing for the states that you're in. I put this here, FYI, for your information. ASHA is not going to ask a question about every state. But if you're working in a state, you may want to know what their state licensing code of ethics is. Bottom line, maintain ethical practices as an SLP, or as my picture says, don't lose your angel's wings. Okay, so now let's look at other issues related to ethical practices and professional practices, which have to do more with just general professional things, which are still within our ethics. One big thing, Ash is really big on this, okay, it's called cultural competence. Okay, one of the things is that I think if you haven't learned this in school, we as speech language pathologists are going to work with a lot of people from many different cultures, many different language backgrounds, whether they're bilingual, multilingual, or just only one language. Good example is one of our sons had a very good friend whose family is of Latinx background. Okay, they're Salvadorian, and therefore their primary language is Spanish. For whatever reason, the family chose, when they came to the United States, they wanted their children to really grasp and live here in the United States. So they don't speak Spanish to their children. Their children only speak English. My son was very surprised because he knew just from the name, the child's name and their family name, and meeting the mother and father of the child, they were friends, right? Okay, that they had the Spanish accents and all, that they were of Spanish background. And he was surprised one day, came home, said to me and his mother, my wife, and said, we'll make believe the child's name is Jose. Is that okay? Okay, it wasn't, but hey, I didn't know this, but Jose doesn't speak Spanish. Like my wife and I look at each other, say, yeah, so, you know, but kind of struck him funny. But we have a lot of people, especially in the United States, who have more than one language, and one of the most popular is Spanish, right? Okay. We need to hold to the highest standards, the cultural differences of individuals with whom we engage, and make sure that when we talk with the parents of children, that we're talking and understanding their cultural factors. An example, okay, in some cultures, the professional, the doctor, whoever it is, must speak with the father to explain things, not the mother. And yet, who usually brings the child in for a speech language evaluation or therapy? The mother, right? Okay. The thing is that we need to understand the cultural aspects of our profession, which basically are the games, activities, therapies that we're doing. Are they fitting okay into the person's culture? Are they accepting it because of that? Because I don't want, I think, not I, but Asha doesn't want, us to be recommending things for people to do that their culture says they shouldn't be doing. Okay. Also, some of the wording we use, not bilingualism. I'm talking about, imagine they're of the XYZ culture and they speak English enough so you can talk with them, but within their culture, there's certain things that's very sensitive that we, in let's say standard American culture, it's not a good way to say it, just find it's just every day, but it's not every day with them. So we need to learn that. Sometimes it's very helpful to find someone who's more familiar with the person's culture than we are. Okay, one example that I can use, and I won't say the culture, but I had a client for an auditory processing evaluation, and the client's background was of a culture that was not standard American culture. Child may have been living here, but that's the culture of his family and all. And one of the things in their family is that their family has the grandparents living with the parents, okay? And when the mother and the father asked to speak, to come and talk about what the test results showed, they brought the grandparents, and they wanted the grandparents in on the conversation as well. Okay, I think typically what we might do in American culture, typically I'm thinking, is the parents would go, or just the mother would go, then the mother would talk with the husband about it, and if there's questions, they would contact the professional, okay? But then if the grandparents are living, then explain it to the grandparents at home. No, it was the grandparents. So grandmother, grandfather, mother, and father all came with the child to the evaluation, and then afterwards came into the office with it was me, I was the person who did the evaluation, to discuss what the findings were. And the father of the child, okay, was often turning to his father. Well, it was actually his father-in-law, it was the mother's father. He was turning to his father-in-law, the grandfather, and asking, well, what do you think? Or, oh, did you want to say something? So it was like a culture that was not something that I'm very familiar with. My familiar culture is usually I talk with the mother, sometimes the mother and the father. Okay, but grandparents as well. Okay, if that's part of your culture, if that's what you want, fine. Okay, cultural differences, age factors. How many of you would agree? We'll take parents. Parents who, let us make believe were, I'll just use ages. Let's say parents of or older people, okay, let's say in their 80s, what they understand what we can say to them, the way we talk to them, may be very different because they're in their 80s than people of the same background who are in their 40s, than people of the same background who are in their 20s. And then if we're talking about the kids, we can go even below 20. I work and live in the Washington, D.C. area. And if you're not familiar with it, our area has a lot of people who are what I would call, armed service families. Okay. There's a lot of military people in this area. And the thing is that, how do I deal with them? That's going to be a little different. Okay. And the thing is that some of them are still active military on base, living on base. And their children are going to the military school on base. Now, very different than the public school, or let's say a public charter school, or even it is a private school in a sense. No, it's not. It's not a private school. It's still a public school, but it's military based run. It's a little different. Okay. Okay. Gender factors. Okay. And this is something I think, that's we're more aware of, I hope, right? Gender factors, sexual preference factors. Okay. Yes, there are going to be people, and they are they, not he or she. There may be people born male who are she's. There may be people born female who are he's. See my face? You see what I'm saying? It's just the way it is. It's a cultural difference than maybe what we are, what I am, what you are. I don't know. Okay. But I love this picture. But oops. All cultures, all people join together as one, right? There may be differences in ethnic factors, linguistic factors, okay, racial factors, and cultural differences. We have to be aware of that, accepting it. That's very important. Okay, unethical practices, discrimination. I think we know what that is, right? Not telling the truth. I love this picture. Okay, misrepresenting things. Okay, working outside your scope of practice, working without appropriate certification, qualifications, education, knowledge, conflict of interest. Okay, we don't want to be unethical. And these are things that Asher may ask a question of, what's unethical? Okay, ethics in something called telepractice. I'm sure you're familiar with that. Okay, here we are online. And although this may not be, we call it virtual. Okay, when I think of tele, I think we all would think of, I was looking for my cell phone, I was going to hold it up, telephone, but it isn't. It's also online. Okay, I have a good referral source that I refer to for certain things where I would say easily 85% of what the person does is virtual. Now, why did I say what they very often do is they see the client that I refer and they have them face to face at certain times, okay, to get the again, I work with children or adolescents, to get the client, okay, as well as young adults, college students, okay, so to get the person, the client, to know what they're supposed to be doing, but then they meet with them online, sometimes once a week, and they're doing exercises from the internet or things that they can download, okay, or programs for whatever the issue is that they're working on for auditory processing, okay? But the thing is that telepractice is the application of telecommunication technology. The main thing about telepractice, okay, now this person that I'm talking about, okay, this person I'm talking about is licensed in his state and only will see people from his state. There's another practice that I work with. It's not speech-language pathologists. They do more occupational therapy kind of things. And the thing is that they are in the state of Maryland, but they also hold licenses in the District of Columbia and in the state of Virginia. This area, fancy word, they call it the DMV. D for district, M for Maryland, and V for Virginia. Why? Because they see so many people virtually online, okay, in Maryland and in Virginia. I mean, in Maryland, that's the state where they are located, but also in Virginia and in the District of Columbia. And because they see them in their office from Maryland online, or even their home from Maryland online. Okay, I don't know exactly where they do their work. Okay, but they're good people. But they're licensed in three places. And here you can learn more about it by going to ASH's website. ASH's position is telepractice is appropriate. It is an appropriate model for service delivery for audiology and speech language pathology, and it may be used to overcome the barriers of access. And that's why the person who's the OT group in Maryland uses it, because some of the things they do, many OTs do not do. They do not work on a lot of the movement and a lot of they work differently on some of the sensory stuff, but they do a lot of work on auditory stuff. And that's why I like them, because they do a lot of auditory kinds of things for sensory auditory processing. And that's where I refer, okay? That's when I found them. That's why I referred. The other person, a speech language pathologist, he works primarily with I would say, young adults. Okay, when I say young adults, I don't know, I don't refer to them, but I think that he doesn't see adults beyond, let's say, maybe the age of 50. Okay, and he does a lot of work with children, a lot of work with adolescents, a lot of work with college students, young adults in their 20s, but up to about maybe 45, 50, then he refers them on to someone else, because that's not the thing he likes to work with. That's not what he chose to work with. And because especially a lot of the people who, let's say, I'll use the age 30 to 50 are working, it's hard for them to come into the office, so he sees them online. And for the children, the parents are okay with the kids doing practice online. Okay, professional practice, but as I said, this professional is in the state of Virginia and only sees clients in Virginia, because even online in Virginia, because that's the only state in which he's licensed. Okay, professional practice, be licensed and certified to provide in the state, not where you're working, but where the client is. So if you have a client in California, or this person in California who wants you to do services, therapy with them, and you're not licensed in the state of California, how can you do it? Easy. You could be supervised by a state licensed, a California state licensed speech language pathologist. Therefore, you're a consultant. And the person who is you're supervising needs to actually be doing the work. You just observe it, how your supervisors observe things. Okay. And so that's accepted, but you're not doing the therapy and the other person just sitting there because they have the license, or you're doing it and the person's come to their office. But a lot of telepractice is done in people's homes. Okay. There's been updates on this telepractice. Members are required to inform ASHA within 30 days, or updates on code of ethics. If you're being convicted of something, okay, if you are guilty of something, or if you plead something called no contest. Okay, so in other words, let's say the state licensing board finds you guilty. Okay, it is your ethical duty to notify ASHA before the state licensing board even notifies them. Okay, also 30 days if they have publicly sanctioned by any accrediting agency or license. In other words, if a agency, school district, maybe if you're working in a school district, whatever, were to fire you or whatever, because they say you're working unethically, okay? It's probably better for you to say, I was just, I had this complaint from blah, blah, blah. They just fired me. They may bring code of ethics, against me. Okay, but these are my statements. This is what I, say, what I do, right? In the past, the agencies and licensing boards would notify ASHA, but now ASHA is also saying you, the professional, should notify them. Updates 2 and 3. Members must report colleagues. Like I said, the speech science pathologist, in a sense, that's not my colleague, but in a sense, it is a colleague because someone working within our professions of speech science pathology and audiology. I brought it to the attention. Okay. And I did it through the parent rather than directly, but I could have done it directly. But the parent was very happy to do it. Okay. Mainly, I did it through the parent because I didn't know the child except when the parent brought the child to me and asked if I would review the other person's evaluation, because the parent was wondering what's really going on with the child in terms of their auditory processing. Okay. My comment is, who makes the determination of skillfully, right? That another colleague is not skillful or they're not functioning safely. Okay. Well, you do. Okay. We have to say what's skillful. In other words, you've got to use evidence, right? Members may not knowingly make false financial or non-financial statements. Okay. And that's really, were you paid or were you not paid? Imagine if you were paid, but you don't claim it. You hide the money. Okay. Or somehow you get someone you go to the bank and you just don't deposit it, you cash their checks. You don't accept credit cards because that's definitely going to go to the bank. Imagine if you only take people and say, if you pay me by cash, I'll reduce my fee from 100% to 80%. So the 20% reduction, pay me cash, and then I put the cash in my pocket and I don't claim it. No, you worked. You're supposed to claim it. Okay. This is all part of the disclosure statements. Okay. Okay. Certified professional must use independent, evidence-based clinical judgment. Okay. And I love this. Okay. Be ethical, have respect, integrity, and be honest. Right. And we'll talk a little bit about evidence-based practices later. Okay. Laws. I think we all are familiar with the HIPAA privacy law. Okay. Here's a good example again. Okay. I got a parent who asked me if I could speak with the psychologist who completed a psychological evaluation of their child after I did the auditory processing evaluation. First thing I said to them, I'd be very happy to do so. Please, one, okay, you didn't put the psychologist's name down on your consent form. So I said, if you still have the consent form, could you, in other words, rewrite it, add that person. If not, send me even an email, a letter, but it's dated. It's the thing I like about email. I'll save the email. It's dated, and I'll print the whole email. Okay, which includes the date. That so-and-so, what? On such and such a date at such and such a time, emailed me giving me this permission. So I have evidence to speak with the psychologist. So the mother was very nice and did that with the email. But in my email, I said, did you contact the psychologist? The psychologist needs to know if they can talk to me. And then the mother did not. But the mother wanted to know after 2 weeks why the psychologist hadn't contacted me, or I hadn't contacted the psychologist. I said, well, I was waiting for the psychologist to let me know, or you to let me know that the psychologist has the approval. Finally, believe it or not, it was 2 days ago. Wait, today's Tuesday? Monday, yesterday, that I got the email to myself, CC'd, but to the psychologist, that I give you permission to speak with Dr. Lucker, and I give Dr. Lucker permission to speak with you. So I immediately emailed the psychologist saying, it's nice to meet you. I'd be happy to talk with you. When can we get together? By phone or virtual, is not what we do. Individual Disability Act, IDEA, it's education. Be familiar with it. Okay, speech science pathologists, you're working when you're with schools, the main thing with schools. Oops, what happened there? Sorry, I don't know what happened there. Here we are. The main thing with schools is that your speech, language, communication issue needs to be what? Educationally a problem. Okay. I can't answer this because I don't know. Ask someone else. I don't work in the field of swallowing. But according to ASHA, we as speech-language pathologists who work in the schools can also work on swallow issues. I don't know if that's just with infants, young children, but if you had a child, let's say, I don't know, let's say a child doesn't eat properly or needs something, okay, we're not psychologists, right? To work on their, maybe it's they're avoiding it because of psychological issues, okay, but IDEA talks about. IDEA for us mostly is we have a category called speech language impairment. Okay, and that's important. Communication is part of that. Social communication is part of that, such as working with children with autism spectrum disorder who may be in the schools. Okay, NCLB, we'll go over that too. Okay, HIPAA is privacy for the people we serve. Okay, and mainly HIPAA says be ethical. Okay, and they have their regulations too. Okay, ASHA may not ask you what are the regulations, because it's very similar to ASHA's regulations too, but basically is to care about your client, and your client comes first. Okay, and privacy. Okay, IDEA, what is it? The Individuals with Disability Act. Okay, and it covers children 3 years to 21. Okay, preschool through basically 21 years old, in case the child is still in school at 21. Okay, Part B funds covered children ages 3 to 20. I'm sorry. Okay, services are provided as outlined in the IEP. I think you may be familiar with that, the individual education plan. Okay, and for preschoolers and all, sometimes it's called the individualized family service plan. So you're working with the whole family as well as the child in preschool. Okay. There's also something in 2001 that came out called No Child Left Behind. That's the NCLB. Okay. And mainly in that is that Elementary Secondary Education Act and all. It basically says that if a child is a little slow, that child may still need some accommodations or something. No child is to be left behind. Our job is to find out if their educational problems are being caused by or due to speech, language, communication disorders. Okay. To me, the most common one, other than auditory processing, that's the audiologist, that's me. Okay. Auditory processing problems are also in there, but auditory processing problems also are covered under specific learning disability. The first specific learning disability identified in the IDEA is, ready, a disorder in understanding language spoken. That's what auditory processing is. A disorder of understanding language spoken. Okay, under IDEA, there's accountability, the emphasis of works based on scientific research, evidence-based practice, and expanding parental options, and expand local control and flexibility. No Child Left Behind, highly qualified teachers and paraprofessionals. We have the right to recommend accommodations, modifications, alternative assessments for students with disabilities. Give them more time. Have someone read it to them rather than they having to read it themselves. Child using a special thing called an FM system. Children with hearing loss can still be educated in a regular education class. Okay. And there's accountability and adequate yearly progress. Every year, there has to be an evaluation to show that the child. What I'm finding from schools, this is me talking now, is that very often school districts do not evaluate on a yearly basis. They argue that, well, IDEA says it should be every 3 years, and there's standard tests we do every year. But they're very often the tests are informal, done every year, not formal standardized tests. Okay, ethics in receiving payment. I think we know One, is our evaluation medically appropriate? Is there a medical necessity? Is our evaluation educationally appropriate? Okay, if we're, like getting, it's called, if we're private people like I am, getting independent educational evaluations from schools. Okay, speech language pathology audiology services must be viewed as being the treatment category versus the enhancement category. Okay, from a disorder point of view, you're not enhancing. You can still do that privately, and that is still part of our service. I know quite a few speech language pathologists, not quite a few, two of them, so it's not a lot, okay, who work on what we call language or dialectal difference to try to get someone to be able to speak their standard cultural language, their standard family language, but also in business, especially, to speak more of standard American English and even their dialect and their speech. Okay. And so the thing is that still is acceptable and we can get paid for that. But if I have you doing online, stuff, I meet with you 1 hour a week. No, not even 30 minutes a week, but you're doing therapy every day. I cannot put in and say, you have to pay me because you're doing therapy every day. Doing that on your own. It's practice. Okay. So it's not like 5 days a week I'm getting paid. I'm just going to use it. Okay. $20 each, 20, 40, 60, 80, 100. I see you only once a week. It's $20, not $100. I'm just saying for each of the times. Okay. Medical necessity. I think we know what that is, right? Is the speech language services we are providing because of a medical issue? Person has a concussion. Oh yeah, concussion can cause what? A lot of things. And maybe they need a speech language evaluation. Maybe the concussion has been identified by, let's say, a neurologist as affecting Wernicke's area. Person has a receptive aphasia. Okay. The person has a stroke. That's a medical necessity. Our therapy must be reasonable, necessary. You have to identify why it's necessary, specific to whatever the disorder is, effective, evidence-based, and you must be skilled at it. Okay, evidence-based practice, almost finished. ASHA focuses on the application of evidence-based practice. The main thing with evidence-based practice is whatever you evaluate, the tests you use, whatever therapies you do, whatever materials you use, is there published evidence, research to support that this test or this therapy is A, appropriate for the specific disorder you're working on, B, has shown it helps the disorder to get better, right? Isn't that what our goal is? Okay. And so the thing is there evidence to support it? We should always be working with evidence-based practice. Okay. We base our practice on evidence, not merely our gut feelings. Okay. The scientific method, that's the research. Okay. Have there been controls of variables? In other words, did they just do it on 1 or 2 people? Or do they really use a group? Did they really do it appropriately? Did they all follow the same, whatever's the proper research way of doing it? Was it controlled? Did they control for extraneous factors? Okay. And did they have specific research questions that were answered to show that this is the appropriate thing for this test? This is the appropriate tool for this evaluation. This is the appropriate material for this therapy, etc. Variables in research, I think you know that. We have dependent variables and independent variables. Okay. Are they there? Were they appropriate? Okay. Did they do only qualitative? Or do they also have numbers, quantitative? Okay, this is one of the things I find a lot of a problem very often with schools. That schools will very often argue against what I'd use, which is a combination of qualitative and quantitative, but I use mostly the numbers. And then what I view, what I observe, Very often the schools will argue, well, we did it. Why do we need you to do it? Or why didn't you see the child in the classroom? How am I going to know how a child is hearing and processing what the child is hearing by observing the child in the classroom? There could be a lot of reasons why the child isn't paying or is sitting there like this, looking like he's paying attention, but he isn't because he can't understand what the hell's going on. But the child's well behaved, so he's not going to say, what did the teacher say? I don't know. I don't understand what's going on. Can I see your notes? The kid's not going to do that. They get in trouble for it. So they sit there as if they're paying attention, but they're tuned out. I don't know, but we need to use both qualitative and quantitative, not just one. And especially the quantitative, the numbers, the norms are very important. That's evidence-based. And I'm going to skip this. You can read it. It just says what I just said. What can I do? Stay current with your standards and laws. Maintain a reference notebook, okay, with ASHA's, or know and what you've read. Okay, go there. Review ASHA's website. Read the ASHA leader, or now it's ASHA has publications. Join ASHA. Okay, your certification will be reduced when you when you get your C's. Instead of them charging you this much, ASHA members are charged this much. Okay, visit the website regularly. Participate in laws, lobbying efforts, support things for our profession, for our clients. Okay, and improve our services. Educate yourself and increase your knowledge. What do you do now? Review this. Go to the ASHA website. Okay, check their code of ethics. Go over everything. And the last thing, pass the exam. Okay, please. I say this to my students all the time, so I will say this to you. All you need to do is pass the exam. If the passing grade is 500 and you score 500 or 501, but your friend scored 550 or 600, you know what the answer is? You both passed. Thank you all.
Thank you so much, Dr. Lucker. I'll take a minute to see if there are any questions for you before we end for the night.
Surely.
I have no questions actually.
Okay, perfect. Well, with that, we will say thank you, Dr. Lucker, for coming out and giving us a great presentation. This presentation was recorded and will be available on Therapy Ed's YouTube channel within the next few days, along with all of the past lectures. And then please join us again next week for another great lecture. With that, we'll say thank you again and good night.
Good night.
Thank you for
Thank
your
you.
thanks for your
Thank
time.
you. And the best to you, Marta. Okay.
Thank you so much.
De nada, de nada. Adios.
Adiós, adiós.